Welcome to the deep dive. We're diving into AI in medical imaging today.
Ooh, sounds interesting.
It is. Specifically, we'll be focusing on chest x-rays.
Okay.
We'll be looking at a brand new research paper.
Brand new.
Yeah, it just came out on January 30th, 2025.
Wow, so this is really cutting edge stuff.
Definitely. The paper is called VICCA, Visual Interpretation and Comprehension of Chest X-ray Anomalies in Generated Reports Without Human Feedback.
That's a mouthful.
I know, right? But it's a fascinating topic.
So what's the big question we're trying to answer today?
The big question is, how can we make sure that AI-generated medical reports are trustworthy? How can we really rely on them?
Yeah, that's a huge question, especially when it comes to something as important as medical diagnosis.
Exactly.
I mean, AI is getting really good at analyzing medical images.
Right.
But it's one thing for AI to analyze an image.
Yeah.
It's another thing to actually trust the report it generates.
Absolutely.
Especially without an expert there to double-check everything.
And that's what this paper really digs into.
The potential dangers of just blindly trusting AI reports.
Yeah.
What if it leads to a misdiagnosis?
That's a scary thought.
It is. Misdiagnosis can lead to all sorts of problems.
Definitely.
The wrong treatment, delays in getting the right care,
Potentially even harm to the patient.
and not to mention the loss of trust in the healthcare system.
Right. If people start to feel like AI is being used without any safeguards.
Exactly.
So how do we bridge that gap?
How do we balance the potential of AI with the need for reliable results that we can understand and trust?
Well, that's where VICCA comes in.
VICCA.
Yeah, VICCA. It's a new framework designed to address this exact problem.
Okay. I'm intrigued. How does it work?
Well, think of it as adding a layer of visual verification to the AI-generated reports.
So we can actually see what the AI is thinking.
Exactly. It's like giving the AI the ability to show its work.
I like that. Show its work. Makes it more transparent.
Right.
So how does it actually do that?
VICCA uses a two-pronged approach.
Okay.
The first is called phrase grounding.
Phrase grounding.
And what that means is the AI highlights the specific areas on the X-ray image
Okay.
that correspond to its findings in the report.
Oh, I see.
So, for example, if the report says there's cardiomegaly
Which means...
and a large heart,
Right.
VICCA would actually pinpoint the exact location on the X-ray where you can see that enlarged heart.
So it's literally pointing to the evidence.
Exactly. It's creating that visual connection between the words and the image.
That's really clever.
And that's just the first part.
There's more.
The second part is even cooler. VICCA can actually generate a synthetic X-ray image.
A synthetic image.
Yeah, based on the AI's textual report.
So it's like creating an image from the word.
Exactly.
Wow.
And then by comparing this synthetic image to the original X-ray,
Right?
we can spot any discrepancies.
Oh, I see. So any inconsistencies would be a red flag.
Exactly.
Like, hey, maybe this report isn't as accurate as we thought.
Right. It's like a double check system.
That's impressive.
And what's really cool is that VICCA doesn't just say yes or no on the AI's report.
Okay.
It uses a dual scoring system to give a much more nuanced assessment of its trustworthiness.
A dual scoring system. Tell me more about that.
Sure. So VICCA gives each report two scores.
Okay.
The first score is called detection accuracy,
Detection accuracy.
and that measures how well the phrase grounding model aligned the findings with the actual image.
So basically how well it connected the words to the right spots.
Exactly.
Okay, that makes sense. What about the second score?
The second score is called the reliability score,
Reliability score.
and this one evaluates the overall consistency between the original X-ray and the synthetic one.
The one VICCA created from the report.
Yep. So a high reliability score means there's strong agreement between what the AI reported and what's actually on the image.
Okay, so a high score there means we can be more confident in the report.
Right.
This is fascinating. It's like we're moving beyond just trusting AI blindly.
Yeah.
We're actually quantifying how reliable it is.
I know. That's a huge step towards making AI and healthcare more trustworthy.
Absolutely.
So let's talk a bit more about the phrase grounding model.
Okay.
How does it actually learn to connect words to specific areas on an X-ray?
Well, the key is that it's specifically trained on chest X-ray data.
Oh, so it's not just looking at any old images.
Right. It's learning from images and reports that are specific to chest X-rays.
I see.
So it's learning to understand the language of those reports.
The medical terminology.
Exactly.
And the subtle things that radiologists look for.
The visual cues, the pattern.
Right. It's like a medical student learning from years of anatomy and pathology studies.
Perfect analogy.
Now, I remember the paper mentioned something called BiomedVLP-CXR-BERT.
Ah, yes. That's a specialized text encoder.
What does that mean?
It's essentially a medical dictionary for the AI.
Oh?
It helps VICCA understand the medical jargon in those chest X-ray reports.
Got it. So it's like translating medical speak into something the AI can understand. The paper gave a great example to illustrate this.
Oh, yeah. What was it?
They showed a standard AI model, one that wasn't trained on medical images.
Okay.
They showed it a chest X-ray with the caption, cardiomegaly with mild pulmonary vascular congestion.
Cardiomegaly, that's the enlarged heart, right?
Yep. So you'd think the AI would be able to pinpoint the heart on the X-ray.
Right.
But this AI just identified the whole image as the object.
It didn't even try to find the heart?
Nope, because it didn't understand the medical language in the caption.
Wow.
But VICCA, because it was trained on medical data, was able to pinpoint the exact area of the enlarged heart.
That's a really good demonstration of why that specialized training is so important.
I agree.
It's not enough for the AI to just see the image.
It has to understand it in a medical way.
Exactly.
Now, let's shift gears and talk about that image generation module.
Okay.
How does VICCA actually create a synthetic X-ray based on the report?
Well, it uses a technique called text-to-image diffusion.
Okay, and what does that involve?
Essentially, it's translating the words of the report into a visual representation.
So it's like the AI is painting a picture based on the report.
That's a good way to put it.
But it's not just any picture.
Right.
It actually preserved the anatomical structure of the original X-ray.
Oh, wow.
So the synthetic image is realistic and medically relevant.
That's incredible. How does it do that?
Well, it uses something called binary lung segmentation masks.
Binary lung what?
Segmentation masks.
Okay, what are those?
Think of them like a guide for the AI.
Okay.
They help the AI focus on the most important areas of the X-ray.
Which would be?
The lungs.
Oh, right, because we're talking about chest x-rays.
Exactly.
Okay, that makes sense.
And the researchers actually did a really interesting experiment with this.
Oh!
They gave the model a totally random report.
A random report.
Yeah, one that had nothing to do with the original X-ray.
Okay.
So the report and the image were a complete mismatch. But even with this random report, the model was still able to accurately synthesize an opaque right lung.
An opaque right lung.
Yeah, which was present in the original image.
So even with irrelevant information, it was still able to capture that anatomical detail.
Exactly. It shows how powerful this system is.
That's really impressive.
So we've covered the phrase grounding, the synthetic image generation.
And the dual scoring system.
Right. Now, how did they actually validate VICCA? Like, how did they make sure it actually works?
Well, they focused on objective metrics and comparisons.
Okay.
So rather than just relying on human opinions.
They used hard data.
Precisely.
So how did they do that?
For the phrase grounding model, they used a metric called mean average precision,
Okay.
which measures how well the model linked the text to the correct regions on the image.
So how well it was reading and seeing at the same time.
Exactly.
What about for the image generation?
For the image generation, they used metrics like the multi-scale structural similarity index and the DICE score. These compare the synthetic image to the original one.
Making sure it's actually accurate, not just a pretty picture.
Precisely.
But how did they validate the overall reliability? Like its ability to tell if a report is accurate or not?
That's a good question. They did something quite clever.
What did they do?
They used VCCA's ability to generate those synthetic x-rays.
Right.
They created two scenarios. In one, they used the original accurate report to generate a synthetic image.
Okay.
In the other, they used a completely random report,
I see.
like a control experiment.
So they wanted to see if VCCA could tell the difference between a report that matched the image and one that was totally off.
Exactly.
And what happened?
The results were very clear.
Okay.
When they compared the synthetic images to the original X-ray,
Right.
there was a much higher similarity when the original accurate report was used.
That makes sense.
But when they used the random report, the similarity scores plummeted.
So VCCA was able to flag the random report as unreliable?
Exactly.
That's amazing.
It really shows that VCCA isn't just taking the AI's word for it,
It's cross-checking it with the actual image.
adding that extra layer of trust.
Now, did they look at how VCCA performs with different types of medical problems?
They did. They analyzed a range of common chest X-ray findings.
Like what?
Lung opacity, pleural effusion, cardiomegaly, edema, even fractures.
And how did it do?
Well, they found that VCCA's performance varied depending on the pathology.
So some conditions were easier for it to interpret than others?
Exactly.
Which ones were easier?
Lung lesions and fractures, although they were less common in their data set,
Okay.
they tended to have higher similarity scores.
So the AI was pretty good at detecting and describing those.
Yes,
And I imagine those are pretty visually distinct.
they are.
What about the more subtle findings?
Things like pneumonia, pneumothorax, and pleural abnormalities were a bit more challenging.
I can see why.
Those often involve very subtle changes in the lung tissue.
Making it harder for the AI to pinpoint exactly what's going on. And edema.
Yeah.
How did it do with edema?
Edema was the most ambiguous.
Really?
Yeah, the similarity scores were all over the place.
So the AI had a hard time telling edema apart from other things.
It did.
Which makes sense, because edema can look different depending on what's causing it.
That's true.
So it's a good reminder that even with all these advances, AI still has limitations.
Definitely. But even with those limitations, the potential of VICCA is huge,
I agree.
especially the fact that it doesn't need an expert to validate it.
Right. That makes it much more accessible.
Exactly. And the researchers see it as a platform that can keep getting better.
Keep learning and evolving.
Right. Potentially even incorporating feedback from radiologists to improve its accuracy.
So it's not a static thing.
Not at all. It's a dynamic system that can keep growing and improving.
That's really exciting.
It is. It has the potential to be an incredibly valuable tool in so many different healthcare settings.
Well, we've covered a lot of ground just in this first part of our deep dive. We've looked at the technical details of VCCA, how it was validated, and even how it performs with different pathologies.
It's been a great overview.
But now, I think it's time to step back and look at the bigger picture.
Okay.
How could VICCA actually change healthcare? What impact could it have?
That's the question we'll be tackling in part 2.
So stay tuned.
You know, I think one of the biggest impacts could be on doctors.
Doctors.
Yeah, like empowering them with a tool to assess those AI reports.
So they can quickly tell if the AI is on the right track.
Exactly. And it's not just about speed, it's about reliability too.
Because VICCA actually gives you those scores.
Right. So doctors can see how much they can trust the AI's findings.
I can see this being especially valuable in areas where they don't have a lot of specialist doctors,
Oh, absolutely.
like rural communities or places with limited resources.
Yeah, places where it's harder to get a second opinion from an expert.
VICCA could help bridge that gap,
Exactly.
make sure that patients are getting accurate diagnoses no matter where they live.
That's the goal, right?
Yeah.
To improve healthcare for everyone.
It could be a game changer in terms of health equity,
I agree.
bringing that high-quality diagnosis to everyone.
And it's not just about geography either.
What do you mean?
Think about busy hospitals
Okay.
where radiologists are swamped with cases.
Yeah, they have tons of images to look at every day.
VCCA could help streamline their workflow
How so?
by allowing general practitioners to handle those more routine cases.
The ones where the AI is really confident,
Exactly. And then the radiologist can focus on those really complex cases.
the ones that really need their expertise.
Right. The ones that are more challenging for AI.
That would free up so much time and resources
And potentially lead to faster diagnoses for everyone.
and better care overall.
Exactly.
It's really amazing to think about the ripple effect this could have.
I know, right? It could touch every part of the healthcare system.
And, we've been talking about chest x-rays,
Right.
but VCCA's potential goes way beyond that.
Oh, definitely. The researchers believe it could be adapted to other types of medical images.
Like what?
CT scans,
Okay.
MRIs,
Wow.
even ultrasound images?
So it could be used to analyze all sorts of medical problems.
Potentially. It's a really versatile framework.
It's amazing to think about all the possibilities.
I know, it's pretty mind-blowing.
Imagine a future where AI can help diagnose all sorts of conditions
Faster,
more accurately.
leading to better outcomes for patients.
That's the dream.
It is. But of course, we have to be realistic.
What do you mean?
There are always challenges with new technology.
Right.
We have to be aware of those.
I know we've been focusing on the positive,
Sure.
but what are some of the concerns you have about this technology?
Well, one challenge is making sure these AI systems are fair.
Fair.
Yeah, fair to all patients.
Okay.
We have to be very careful about potential biases in the algorithms.
Biases.
Yeah, like if the data the AI was trained on isn't representative of all patients.
It could lead to inaccurate diagnoses for certain groups.
Exactly. So we have to make sure these tools are accessible to everyone.
And that they work equally well for everyone.
Right. It's a matter of equity and justice.
It's like any tool, really.
What do you mean?
It can be used for good or bad.
Oh, I
To make sure we're using it responsibly.
Absolutely. That's our responsibility as developers and users of this technology.
So how do we mitigate those risks? How do we make sure it's used ethically?
Collaboration is key.
Collaboration.
Yeah, we need everyone at the table.
Who's everyone?
Researchers,
Okay. Clinicians.
doctors and nurses
Right. Policymakers.
to create the rules and regulations
Exactly. And patient advocacy groups, too.
to make sure the patient's voice is heard.
We need all those perspectives to ensure that AI is developed and used in a way that aligns with our values.
Our ethical values.
Right. And our societal goals.
It's a team effort.
It is. We all have a role to play.
And I think it's really important to remember that the goal of AI in healthcare isn't to replace doctors.
Oh, definitely not.
It's to help them, to augment their skills and knowledge.
Exactly. To give them more information to make the best decisions for their patients,
It's about creating a partnership between humans and AI.
where each brings their strengths to the table.
That's the ideal scenario.
Now, you mentioned earlier that VCCA doesn't need expert oversight to validate it,
Right.
which is great for accessibility.
Makes it more widely available.
But how do we make sure that non-expert users, like general practitioners, can really understand the results?
That's a great question.
Because it's one thing to have the tool.
It's another thing to know how to use it properly.
Exactly. So how do we bridge that gap?
Education is key.
Educating doctors about AI.
Yes. We need to provide them with the knowledge and skills they need to use these tools effectively.
So it's not just about building the technology.
It's about building the human capacity to use it responsibly.
That makes a lot of sense.
We need to equip doctors with clear guidelines, training materials,
Help them understand how to interpret the results.
how to spot potential limitations.
And how to integrate those AI insights into their own clinical judgment.
It's about empowering doctors to make informed decisions.
Decisions that are in the best interest of their patients.
Exactly.
It's fascinating to see how AI is changing the face of medicine.
It's a really exciting time.
But we have to approach it with caution.
And thoughtfulness.
How do you think we can strike that balance between embracing the potential of AI
Right.
and preserving the core values of human-centered healthcare?
Well, I think one key principle is transparency.
It's transparency.
Making sure that these AI systems are understandable.
So we can see how they're working.
Exactly. So we can identify potential biases or risks.
Because transparency builds trust.
It does. Trust in the technology.
And trust in the healthcare system overall.
Right. And another crucial principle is accountability.
Accountability for what?
Accountability for the decisions that AI makes.
So if something goes wrong, we know who's responsible.
Exactly. We need clear lines of responsibility
And mechanisms for oversight.
to make sure AI is being used ethically and safely.
That makes sense.
And of course, we need ongoing research and evaluation
To keep track of how AI is actually impacting healthcare.
to see what's working, what's not working,
To identify both the benefits and the limitations.
and to adapt and improve these systems over time.
It sounds like we need a multifaceted approach
We do,
involving not just the technology itself,
but also education,
ethical guidelines,
regulatory frameworks.
and ongoing research.
It's a complex challenge.
But the potential rewards are huge.
They are. If we get this right, we can transform healthcare for the better.
Make it more equitable, more effective, more patient-centered.
That's the goal.
Well, we've covered a lot in this discussion.
We have.
The potential impact of VCCA, the challenges, the principles that should guide us.
It's been a really thought-provoking conversation.
Now, let's get to the heart of it.
Mm-hmm.
What are your hopes and concerns as we move forward with AI in healthcare? What are the ethical considerations we can't afford to ignore?
It's been fascinating diving deep into VCCA.
It has.
I mean, the potential to revolutionize healthcare with AI is incredible.
Absolutely.
And as we wrap things up, I think it's worth emphasizing that
Yeah.
we've focused on chest x-rays with VCCA.
Right, because that's what the research paper was about.
But its applications could go so much further.
Oh, definitely. The paper actually mentioned that.
They did. They
Yeah.
see VCCA as a framework,
A framework.
something that can be adapted to other types of medical imaging.
Like what?
Well, imagine using it to analyze
Yeah.
CT scans,
Okay.
MRIs,
Yeah.
even ultrasound images.
So it could be used for all sorts of medical conditions.
Exactly. Possibilities are vast.
It really makes you think, if AI can be this reliable
Yeah,
at interpreting medical images,
right.
what other healthcare challenges could we solve with it?
That's the big question.
It is.
I mean, imagine AI helping us detect diseases earlier, predict how patients will respond to different treatments.
Personalized medicine.
Exactly. Or even help us develop new drugs more efficiently.
It's incredible to think about.
It is. AI has the potential to completely revolutionize healthcare.
But of course,
Yeah.
we have to proceed with caution.
Absolutely. We've talked about the potential benefits,
Right.
but we can't forget about the potential risks.
Like what?
Well, we need to be very careful about bias in these AI algorithms.
Making sure they're fair to everyone.
Exactly. And we always need to keep human oversight in the loop.
So doctors are still making the final decisions.
Right. AI is a tool to help them, not replace them.
A tool that we need to use wisely.
Absolutely.
So, as we move forward with AI in healthcare,
Yeah.
what do you think is the most important thing we need to do?
I think it's communication.
Communication.
Yeah, we need open and honest dialogue between everyone involved.
Who's everyone?
Well, researchers, of course,
Okay.
clinicians,
Doctors, nurses,
right, policymakers,
Right.
ethicists.
and most importantly, patients.
Absolutely. We need to hear from the people who will be most affected by this technology
That's how we build trust.
and make sure that AI is used in a way that benefits everyone.
It's a collective effort.
It is. We all have a role to play in shaping the future of healthcare.
Well said. This has been a fascinating deep dive into VCCA.
I agree.
It's given us a glimpse into the potential of AI to transform medicine.
And the challenges we need to address along the way.
But most importantly, I think it's left us with a sense of hope.
Hope.
Yeah, hope that we can harness the power of AI to create a healthier future.
For everyone.
Exactly, for everyone. So to our listeners out there, thank you for joining us on this deep dive.
It's been a pleasure.
We hope you've learned something new and exciting today,
And that you'll continue to explore the fascinating world of AI in healthcare.
because the future of health is in our hands, and it's a future we can all help shape.
That's a great way to put it.
So until next time, stay curious and keep exploring.